Okay, let's get everyone joined in. Right. So who's in attendance? Welcome, Danielle. Welcome, Fiona. Great. Welcome, Mary. Great to have you all here. Fantastic. All right, then. Let's get this started as everyone rolls in. Good evening, and welcome to the Business of Aesthetics Summit series, where we are going to be talking about standing out in aesthetic medicine, clinical differentiation, patient trust, and digital influence. I'll be your host for this session, Dan Adisha. And over the next 2 hours, we are going to go beyond the idea that standing out simply means louder branding or more treatments. We are going to look at what patients actually see, feel, right? And verify your clinical expertise, your standards, the consistency of the experience, the trust you build, and the digital signals that makes all that credibility visible. A couple of quick housekeeping notes before we begin. First up, yes, we are recording, and you will receive a replay link after the event in your inbox. But do not let that make you passive because the real value is happening right here, right now, live. So I encourage you to use the Q&A button for any specific questions you want the panelists to answer. And you can use the chat for conversation, quick reactions. I am on both the feeds. So please be part of the room. We love the engagement. Right. And before we get into the program, a sincere thank you to today's sponsor, Eco Marketing. Uh, Eco Marketing is founded by Naren Earl Raja, the very same founder of the Business of Aesthetics community. Eco has been helping private practices grow for more than 15 years and serves markets across the USA, Canada, and the UK. Their work centers on three things that matter directly to tonight's conversation: SEO and visibility so that the right patients can find you, conversion-focused websites that turn attention into action, and of course, content and social authority that help patients understand why they should trust you. Right now, we will hear a little bit more about Equa down in the program later on. And yep. So thank you very much, Equa, for making it possible for us to have these complimentary educational sessions. Program itinerary. So this is the agenda for tonight. I'm going to end the opening remarks very shortly, and then we'll get into marketing, a mini marketing masterclass with none other than Naren Arul Raja. And then we will be following that up with a brainstorming session, a round robin panel session with Tracy, Rebecca, and Haley. Unfortunately, Amber will not be joining us tonight because of some unexpected circumstances. But Amber, we really appreciate you, and yeah, we'll miss you, but we will keep on continuing things. And then we'll be wrapping things out with a live Q&A session. So that's a ask me anything sort of session. Make use of the wonderful panelists here tonight. Get their expertise and ask your questions there and then. And yeah, we'll be closing things out by 9 p.m. Uh, and we look forward to a wonderful session ahead. With that being said, let's go ahead and get into the marketing session here. So we're going to start with the market-facing side of differentiation. In a crowded aesthetic market, what does real differentiation actually look like in 2026? And how does a practice communicate it without falling into hype? Now, for that, I want to bring in Naren Arul Raja. Naren is the CEO and founder of Eco Marketing. He leads a team of more than 250 professionals helping private healthcare practice owners thrive in the digital landscape. Naren is opening tonight by helping us define what real differentiation looks like in a crowded aesthetic market and how practices make that difference visible to the patients they want to serve. Naren, welcome to the summit.
Hello,
There
everyone.
we
Thank
go.
you for being here. Of course, we want to take a minute to welcome our panelists. We can't do what we do without you. This is, I believe, our sixth year, so we are very proud of staying consistent and continuing to add value in the form of our Facebook group, in the form of these events. So thank you, everyone. The team, of course, all the attendees who took time out of their day, really appreciate you. And of course, all the participants, all the panelists who help us put on these events. Thank you. I'm really looking
Absolutely.
forward to today's session. I do think people's time is very, very valuable. So I'm going to hopefully hit some high points, a few things you can make note of and take some action on before you're done. So hopefully you get some value from it. So feel free to take notes, take screenshots. Capture the notes. And if you have any questions, always you can ask us on chat or just go to Business of Aesthetics and contact us, and we'll definitely get back to you within one working day.
Amazing. So Naren, before we get into the segment here, I do want to take a quick pulse check of our room. I'm going to launch a quick poll. Here we go. Just to get a pulse of the room here. So the question is, which of these feels like the biggest reason your practice is not standing out as clearly as it could? So the answers are A, our positioning sounds too familiar to our competitors. B, our patient experience and trust signals are not consistent. C, our clinical or compliance standards are strong, but we do not communicate them well. Or is it D, the right patients are simply not finding us online? Let's get a quick pulse check over here so that we know what the priorities are of our attendees in the room. Okay, so currently A is leading the charge with our positioning sounds too similar to competitors. That's great because you are in the right place tonight. With D, the right patients are simply not finding us online. And that's also, good to have out there because, by the end of Naren's segment, that should change. Of course, followed by C and B, which is, clinical compliance standards and patient experience and trust signals just not being that consistent. Fantastic. I'm going to let this be on for another 5, 4, 3, 2, 1. I'm going to end the poll here and share the results. Right. So, as you have polled in, the biggest problem everyone here tonight is facing is the positioning sounding too similar to the competitors, followed by the right patients just simply not finding us online. And of course, clinical compliance standards don't seem to be getting communicated well enough. And then finally, last but not least, a very critical component, of course, being the outpatient experience and trust signals just not being as consistent. So thank you very much for everyone for polling in because we will be able to kind of align the discussion a little bit around your priorities as we go through the summit. Okay, here we go. I'm going to stop sharing that. And all right. So Naren, let's get into our discussion here. My first question to you is, in a crowded aesthetic market, what should practices communicate if they truly want to stand out?
Thank you for that question. And I want to kind of comment on the poll. And I think
Yes.
what our audience is saying as to their top two challenges, I think it's right on the money. Number one, they're saying our positioning is not correct because if it was correct, the number two answer, we are not attracting the right patients. So 72% of the people gave these two answers. Either our positioning is not correct or we are not attracting the right patients. Your question is, in a crowded aesthetic market, what should practices communicate if they want to truly stand out? I want to go back a little bit and go back to first principles. And what I mean by that is sometimes we have to change the way we think if we want to be successful. We obviously do what our common sense tells us to do, and we have heard the word positioning and so forth. So we try to quote unquote position ourselves. But let's step back and think about the buyer's journey. How does an average person end up choosing an aesthetic practice? Usually, 5% follow, celebrities or people they are attracted to. Like for example, Oprah's psychologist, Dr. Oz, or sorry, not Dr. Oz, but or it could be like Oprah's, weight loss doctors. So there are few people who, of course, love celebrities. So if you are a celebrity online, that is one way. For sure, build your brand. People will come and find you because they see you as the expert. They like you. They trust you. They see your content every day. Perhaps you're posting once or twice a day in terms of videos. But very few of the people that I work with enjoy being a celebrity and enjoy posting 2 to 3 videos a day. So if you're not in that bucket, then how do people find you, right? Usually, um, they currently have a provider they like, or they don't. If they don't, maybe they moved into the new town, or they don't really like the provider, or the provider can't help them with all the things they're looking for. They go to Google and they start searching. And I'm using Google as a synonym for search. So usually 95% of people today use Google, and that could be AI overview, AI mode, Google search, or Google Maps. Or they could also be going to ChatGPT or Perplexity. So they start with one of these platforms they trust. They start asking questions. Partly they are learning about what they need. Partly they're also discovering who they can help them. So that's where they
Mhm.
start, just educating themselves, getting to know things, right? And then they might stumble on a website. Most of the time they're on a mobile device. So your website, is it easy to use? Is it, you know, getting them hooked, engaged as soon as they enter? Is it fast? Then let's say they get hooked, they get engaged, then they remember you. Some people immediately make decisions, but most people will sit on it and they'll come back and they'll look at it again and look at it again. And after a while, 2, 3, 4, 5 days goes by, and then something triggers them. Usually, like, hey, they see somebody who looks 5 years younger, 10 years younger, or the wedding is coming up, or something makes them want to take action. And then they again remember you. Maybe they're again on Google looking for information or ChatGPT. They stumble on your website. This time they read your reviews. Why? After they, check you out, they want to make sure you are who you say you are. Other clients or other patients also like you. And then finally the phone rings. And how is that phone experience? Is it, you know, clears all their doubts, make them feel welcome, and gets their appointment booked or not? If any one of these things is not working, you're not going to attract any patients or your ideal patients. Couple of
Okay.
holes that I noticed. One is the way the phone is answered. The average aesthetic practice only books 1 out of 3 new patients. And the unfortunate thing is, average aesthetic practice does not record phone calls. So they don't even know there is a problem here because the problem is invisible to them. And a lot of practices don't even answer the phone call. Like I have seen this time and again where the owner thinks all the calls are answered, they're answered really well, but the reality is that's not the case. So, so all of these things can hurt you. So if you're not getting ideal clients, start with that. Do I understand the buyer's journey? In the buyer's journey, are people finding me, for the things I do? And then do they fall in love with what they hear or see online? The website, the reviews, the videos, etc. And then finally, how is the phone? If any one of these things are not working, you're not going to succeed. So the reason I kind of changed the question is sometimes when we ask the wrong question, we get the wrong answer. So I appreciate the question. I bet it came from one of our audience, but it is the wrong question to ask. So really start by saying, okay, do I understand the buyer's journey, and am I interjecting my practice in the right way, and am I being consistent? We talk about consistency, right? The most successful people in life, they are consistent. They do the same things. Once they understand what to do, they do it again and again. Um, keep going, Don.
Absolutely, Naren. And no, you can keep going because you were talking about the buyer's journey and being consistent. And I was understanding like all of this comes back to a fundamental point, which is trust, right? We're trying to build and communicate trust. So, how can aesthetic practices build that trust online without sounding overly promotional?
Absolutely. So another thing I want to talk about is this idea of who do you want to be a hero to, right? We can be anything to everything to everyone, but those people who are everything to everyone are typically nothing to no one. So they end up not attracting anyone, not keeping anyone. The patient comes in because they saw a deal is gone, they're never coming back, the Groupon days. And unfortunately, even today, I work with quite a few practices. Most practices, when they start with us, that's one of the mistakes they make. It's deal fatigue. Every day there's a deal, 10% off this, 20% off this. So you end up attracting the wrong kind of people. Then you talk about you're not getting the right people. So coming back to your question, how can aesthetic practices build trust? First, decide who you want to be a hero to, right? Once you have that person in mind, now you can totally optimize your practice. And if you don't know who you are a hero to, let's say you have been in practice 4 or 5 years, go read your Google reviews, especially those 5-star reviews. And usually you will see a pattern. They will say the same things. Oh, they treat me like family. Oh, they have great technology. Oh, they stand behind their work. Oh, they're always, keeping up. They always know the latest and greatest. What are those three, four things that all your clients, especially those who write 5-star paragraph, what I call love letter reviews, saying? That is your brand. That is what makes you tick. That's why they trust you. Remember the word, right? Who are you a hero to? And discover that. Once you know that, your job as a practice owner is to deliver on it. So if they keep saying, you treat me like family, you always have the best technology, keep investing on it. Whatever that makes you a hero to your clients, keep doing that. That's your job as the practice owner, right? I cannot help a practice who has 3.5 stars and 50 reviews, because if nobody in today's world, I'm being honest, like if you suck, if you're not awesome, I don't care what kind of marketing you have, it's not going to work, right? People have choices. They have so many choices. So once you know who you want to be a hero to, stick with it. So now going back to the question of trust, I'm going to give you a few ideas. One is, we like people. We don't like brands. I mean, we all know people who trust the Congress or the central bank or the Fed is at an all-time low, or even the media is at an all-time low. But people who trust people is at an all-time high. Partly in the old days, we didn't have Instagram, we didn't have videos, we didn't have smartphones. So only like the PNGs of the world could afford to get in front of you and get them to trust you. Now, anybody with a personality can do that on their webpage. I go to your page about looking 10 years younger. Let's say you're targeting an older demographic, and I see a welcome video that's so, down to earth, simple, welcoming, kind, generous. Now I start liking you. So one of the things I would recommend when it comes to building trust is put yourself out there. I know, and a question I always get is, should I invest that time doing Instagram, Facebook videos, or should I put those videos on the website? Now, if you have a page that is doing really, really, really well. What is a website? Is a collection of pages. If this page is doing really well because it shows up on Google for many, many searches and lots of people are going to that page, when you have a customized video, 45-second video that talks to me as a consumer, makes me feel at home, makes me feel welcome, is worth its weight in gold. So definitely invest in those videos. Again, you don't need 3,000 videos. If you have 20 pages, 20 videos at the most. Maybe 10 of those are important, maybe 10 videos. 45 seconds. Don't hire anybody. Just hold your smartphone or have somebody else hold it for you. Just speak. Most smartphones today, you can even make a movie with them. They're so good. I'm talking like even 1 or 2 generation old smartphones. Of course, you need some lighting, some basics. If you don't like it, do a new video 2 weeks from now. Put a new video. So it's not a big deal today, right? So video is a very powerful way to build trust. Second way to build trust, I already alluded to, is Google reviews, Google reviews, Google reviews. And I'll talk more about this. But today, Google review has become the one thing you have to check off before somebody would really trust you. What do I mean by that? So always get new reviews. So 10 or more reviews, paragraph reviews every month. Again, there's a whole science behind it. If some of you are thinking, I can never do that, we teach that to clients. If anybody's interested, send a DM or a message saying, hey, I need this cheat sheet on getting 10 plus 5-star Google reviews. Our team will help you with that. We'll send that to you. So that's the other must-have thing around trust. Third thing that seems to work really, really, really well with trust is awards. Why? Is something in our brain that says if somebody wins something, he's the number one in something, i.e. awards, they are better than everybody else. There's no science to it. There's no truth to it, but that's what people believe, right? So if you have won any award, so one of the platforms we have is called Doctor's Choice Awards. So if you are a doctor and you got the most number of reviews in your town among fellow doctors of that type, so let's say dermatology, then you can get that award and you can highlight. I'm just giving you one example. It's free. It's a platform. Anybody who has the most number of reviews in a town will get an award because, and again, I'm talking about reviews from other providers, not from patients. So you can ask your friends to write reviews. doctorschoiceawards.org. Similarly, there are other platforms. You can use them. You can get these reviews and you can work on them. So awards, Google reviews, and simple 45-second videos. Those three things are essential for trust in 2026.
Okay. Now, speaking on the same matter, when a client is trying to search and select for the ideal aesthetic practice that they want to go to, what are some of those digital trust signals that matter most when a patient is truly comparing those aesthetic providers?
Yeah, if I want to rank them, I would say Google reviews, 10 or more 5-star reviews every month is number one. Number two is videos. And also, before and after becomes really, really important if you are providing, high value services, transformations. Why we all can sit here and say how wonderful we are, but nothing speaks like pictures, right? What is a quote? A picture is worth 1,000 words. So if you have those pictures, of course, hide any private, any confidential information like eyes and so forth. So, let's say you're a plastic surgeon, show your work, hide things so it's private, but show that. So people are like, oh, someone who looks like me, someone my age, perhaps has gotten this transformation. I want the same thing. Same thing for, injectables and anything non-invasive where you can make a difference, even like skin tightening and so forth. So that would be the other thing I would add. Now, this is hard. This is one of those things 95% of the practices struggle with. Just like call tracking, they don't track it 95%. This is one of those things. Good news about call tracking is we do it for our clients, so they don't have to lift a finger. But unfortunately, we can't give you before and after. You have to collect them. Again, we have some tips and strategies and how to do it and how to make it part of your business function so you can continue to grow your cases and your examples. I also want to say something else. Don't cheat. Don't get somebody else's work and show it as yours. If you are found out, you are done. Like trust again is very, very hard to earn, but it's very easy to lose. You do one thing that is unethical, you're finished. And people message will spread like a wildfire on Facebook groups, and they're like, don't go to that person. He's a cheat, or he's this or that, right? So be very, very careful not to violate anything that would make you upset. If something would make you upset, don't do it. That's going to make lots of people upset and the message will spread fast. So that's kind of my comments on like what I would focus on in terms of
Right.
priorities.
Right. Now, let's talk a little bit about the reputation, referrals, and the digital authority. How can we use that to really support the long-term growth?
Yes. We talked about who do you want to be a hero to. We talked about why that is important. That gives you focus. We talked about buyer's journey and how you would insert yourself. When people are looking for all the things I do or the kind of provider I am, are they finding me again and again on all these platforms? And then, of course, when they go to the website, is the website compelling? Are we doing all the things to get people to trust you? The one thing that you have to work on, like your marketing company, if they're really, really good at search, for example, they can help you with all parts of that. They can help you dominate all of that. But one thing nobody can help you with is trust. I talked about it, right? The videos, the before and afters, the Google reviews, winning an award. Of course, when you win the award, tell your marketing company they can feature it. Or even if you're featured on a magazine or anything that's third party that other people might know. Hey, say, as seen on this. Here is my article on this. Here is my interview on that. So when people see you on those things, they trust you. Now I'm going to talk about referrals, and this seems to be a challenge for a lot of older providers. What I mean is, in the good old days, there was no Google, there was no internet, so referrals was the number one way people found things, right? Like I remember, like this is going back 25 years. I had a gentleman who was a tech guy. So anytime I bought a new computer, anytime I bought a new camera, remember those days we all had cameras, right? Now our smartphone is our camera, is everything. But so I would call him and say, hey, I've had this camera for 2 years. What do you recommend? He'll give me like a rundown of all the different cameras and what's good, what's bad. And he'll tell me, oh, get this one. This is a good deal. It's going on sale right now. He knows everything. He's like an encyclopedia, the modern day equivalent of Google. Of course, now we have Google, we have all these AI search engines. So he's unemployed right now. Of course, I don't pay him. Maybe I buy him something for Christmas because he's so helpful with all my tech needs. I haven't called him for 20 years, at least not for this. He's still a friend, we see each other and whatnot. But my point is, so referrals don't work in 2026. And even in those days, there are those kind of people, like I just talked about, I call them connectors. They're like 6, 7, 8% of the population. Even in those days, most people are private. They don't want to go and brag about what they like and what they don't. They're not outgoing. They're not seen as those connectors. But in today, in 2026, Google is that connector. Most of us don't ask our friends because then a friend will say, like, haven't you heard of Google? Like, why wasting my time? I mean, you don't want people to say that. So most of us don't do that. So the question I then they ask me is, how do I get referrals? I'm like, your Google review is the referral. I'll tell you a true story. And this happened with one of my best clients. He's a Mount Sinai dermatologist, one of the top doctors. His wife is a nurse. She of course knows every person in like the top, hospitals in New York. And, she's been working in these hospitals, and her husband is a top dermatologist, and her son had a serious issue. You know what she did? She trusted Google. And he was so mad. He's like, why would you trust Google? And of course, this is his wife. So he asked her, and she said, well, I can ask you, I can ask this other doctor, but it's going to be one person's opinion. Here I get 300 people's opinion. I would rather trust 300 people than the best guy in the world. You know what I mean? For that thing. So I think Google reviews has become the 2026 referral. So if you want to get referrals, just make it a habit. 10 or more 5-star Google reviews. Doesn't cost you a cent. Yeah, it takes time and effort. And again, if anybody's interested, DM us and we'll send you that cheat sheet. You really can do this. I've seen practices do this time and again, and we teach this to all of our clients. So Google reviews is the modern referral source.
Now, Naren, that's a lot of great information, very practical too, and we really appreciate it. Now, to make all of this practical for our busy practice owner listening tonight, what's a good next step?
Yeah. So one thing I didn't cover, I just wanted to leave you with. If you are running an aesthetic practice, you need a flow of new patients. That's one part of the puzzle. Then you need to find a way to keep them. And that's what our panelists are going to talk about, and how do you build relationships and all that. One tip, I think I'm biased, I'm not an expert, I'm just telling you based on what I heard, a membership plan where pretty much people pay $99, $199. That's a great way to keep them. So that's something I would strongly recommend. So let's say you have that part covered. Once they come in the door, you make them love you, you make them stay, whether it's a membership plan or whatever, you guys have it covered. Now, when it comes to a new patient, you need new patients and you have options. One, you can become an influencer that, you're posting 2-3 videos a day and you just do it for 2 to 3 years and then you become an influencer and then you have tons of followers. But that is 1 to 2% of my, population, unfortunately, because people don't want to put their private lives out there. People don't want to be media people who happen to be a, aesthetic provider. So very few people really do a good job in that. So the other options are paid ads or organic search, right? Paid Google paid ads or Google social media ads. My experience is Google paid ads. The issue is it works because they are specifically typing in what they want, but it is 5 times more expensive and people don't trust you. So a lot of no shows. So pretty much if you're spending $60 to get a new client with search, organic search, you are probably spending $300 to get a new client from Google ads. The same client from social media ads might cost you $500. Why social media is the worst is because social media, people don't go even looking for that particular thing that you're offering. Rather, they are watching a video and ad interrupts them and is shown to them. So they don't even remember you. So even more no-shows, even less conversion. So I do think, honestly speaking, you need to understand the buyer's journey. You need a strategy. Again, if you are just doing it and you're not really sure, then of course this is not applicable to you. But if you are digging in, if you want to dominate, if you want every year to be better than you need a machine that keeps generating your ideal patients. One of the things we'll ask is, who do you want to be a hero to? That's key, right? We are not going to pick that for you. So you know the answer for that. Again, like I said, read your Google reviews. It already might tell you what makes clients or your ideal clients love you. So once you know that, then I think you need to do an audit on the buyer's journey. Like, how well am I doing when it comes to people finding me? How well am I doing when it comes to all these search platforms, including AI search? How well am I doing in terms of Google reviews? All the technical things that, remember, Google and ChatGPT, they don't have to send you anybody. It's their choice, because remember, you don't pay them any money when they send you people organically. They only make money when you pay for ads. So it's a fight. It's a really a tough fight. 3% of you will get 95% of the benefit. So let us do an audit. That's our gift to you. And it's no cost. It's a $900 value. We spent 6 hours. The link is differentiation.org/MSM. It's our gift. Scan the QR code. There's a link, I believe. Just go to the link, book the meeting. And I think we have 4 spots open right now. And we also have a special. So if you do book it, just mention that you are at this event so we can also give you that special. It's businessofesthetics.org/MSM. The special is you will save $250 a month for 2 months.
Oh, amazing. Thank you very much, Naren, for that. Yeah, so for anyone interested in really understanding their buyer's journey, especially when it comes to their digital front, this is a great opportunity for you. And I know a lot of y'all actually pulled in on exactly that matter itself. So whoever pulled in for our D option, this is a great next step for you as well. So the link is in the chat. QR code is available for you to scan. It takes less than a minute to do so. Availability is a bit limited, as Naren mentioned, since this involves real research into your local market by one of our senior marketing analysts. So go ahead and make use of that. Thank you very much for the wonderful discussion here, Naren. And we will now be moving on to our next segment, brainstorming session. So here we are. We are now going to be moving from the promise a practice makes to the systems that makes that promise believable. Our brainstorming session is about clinical standards, compliance, and digital credibility. What truly sets an aesthetic practice apart when patients look beyond the treatment list. Now, I'm going to introduce our uh, panelists here, and then we will stop sharing and go straight into our structured round robin session. Right. First up, we have Tracy Hota, a registered nurse, educator, and leader whose career in medical aesthetics began in 1984. She was among the first registered nurse injectors in Canada and later served as operating room manager at a leading cosmetic surgery institute, giving her deep experience across surgical and non-surgical aesthetic care. In 2016, she founded the THMA Consulting, a research-based education company focused on raising standards, safety, and ethics in aesthetic practices. She has also held national leadership roles in credentialing and guidelines development for aesthetic nursing. Tracy, it's absolutely a pleasure to have you back here on our Business of Aesthetics Summit.
Thank you.
And then we have Rebecca Landriault. Rebecca brings nearly 20 years of aesthetic medicine from the consumer side to medical aesthetic business operations. And as CEO of Apex Aesthetic Consulting, she advises growing practices on revenue, sustainable operating procedures, and business performance. Her experience includes aesthetic laser purchasing, laser physics, laser safety, and of course, she also holds a Master of Aesthetics from University of Aesthetics Chicago, as well as a Bachelor of Science in Biochem from Purdue University. Rebecca, it's great to have you back here on our panel as well.
Yep, very excited to be here. Thank you, Don.
Absolutely. And next up, we have Haley Wood, a board certified women's health nurse practitioner with more than 20 years in aesthetic medicine and founder of the Look Facial Aesthetics in Franklin, Tennessee, a multi-million-dollar practice she built from the ground up and has operated for more than 9 years. She has trained more than 5,000 providers in advanced injectables, facial balancing, and the aesthetic artistry, serving as a national speaker and a trainer for Revance and co-authored the first CANS study guide. Haley, it's an absolute pleasure to have you here on the panel.
Thanks for having me.
Absolutely. Right then, amazing. We have nearly 100 years of experience over here in our panel tonight. So to our guests, our attendees, please do make the best use of this time. Engage with us during the session, ask for any clarifications you might have, any follow-up questions that are specific to you. Um, and I will do my best to really include those into the conversation as we go along. Now, my first question goes out to you, Tracy. In a crowded aesthetic market, what genuinely differentiates a clinical excellent practice from one that simply offers popular treatments?
Again, thank you for inviting me. A clinically excellent practice is defined by medical foundation, and it's be be prescribed treatments on patients. And it's based on the patient's medical history, the skin assessment, facial assessment, the facial anatomy, and the structure that's the patient's presenting with. And really important to have psychological motivations and expectations as well. If you're just selling popular treatments, you're not going to be taking all of those into account. So, treatment suggestions are based on their outcome of the conversation or the consultation that you're having with that patient, and having them be a part of the conversation so that you can understand what their outcomes are and you're on the same page. You're also looking at those psychological motivators as well. So, if you're just selling a popular treatment, you're just doing it for the financial gain as opposed to doing what's right for a patient. The clinically excellent practices understand that doing a thorough medical consultation, it can identify red flags for people. So if you don't do that real clinical consultation, you may miss a red flag. And if you have one adverse event that could have been avoided, that could be detrimental to your practice. So it's really taking it to that clinical excellence. So yeah, I mean, it's mainly for clinical practices is making sure that you are looking at it as a medical treatment and that it's not financially motivated, that it is something that you're doing the right product for the right patient. And to say no is okay. That's being ethical.
Mhm. Tracy, can you give us some of these red flags that we can identify earlier on?
Yeah, I think a lot of the red flags that we see are more the psychological. So, like body dysmorphic disorder, obsessive compulsive. There are certain clues that you can see that, they're complaining about one area of their face that there's a line or there's a deficit that you can't see. They've got their mirror that they're looking at more than 10 times a day. I think that I had BDD patients, two main ones in my practice, and I myself wanted to keep them in my practice because I kept them safe. They could have gone somewhere else and they would have just taken advantage of them. So definitely that is one of the things that I find is a red flag. It could be, there a lot of patients, being that I'm a surgical nurse, they will not admit that they had facial surgery done. And you're looking at them and they've got scars around their ears or they've had a bluff done and they're like, oh, no, no, no. One patient told me that she got hit in the head. She was lifting something out of the plane and the suitcase hit her in the head. And I was like, the same on both sides? So they just didn't want to admit it. And that can be a risk if they have scarring. You've got to treat that patient a little bit differently.
That's really interesting. So, what truly differentiates is the care that you provide, not just to the patient, but rather the art of aesthetics as well. Because, like, you could have simply ignored that, right? The scar, okay, yeah, sure. You could have not even talked about it, but went deep into it and then really uncovered a bit of a situation with their psychological side of things. Why is that so important? Like, let's stay on
Yeah.
that same patient. What happened to that patient afterwards? Did you brain?
With the one that had the scarring in the forehead.
Yes.
We
Yes.
didn't treat in that area, but and then I
Okay.
started to question her, like, and whenever I sort of learned from that, whenever I'm asking them, have they had facial surgery done, you're going to explain why you want to know that, because it could change your treatment plan. And if you had a vascular occlusion, you won't be healing as properly and things like that. So I think, when teaching people how to do a medical consultation. It's not just asking them the
Mm.
questions, it's asking the question, then explaining why you're asking the question, because then you'll get more information from them and you can dig a little deeper. If somebody, they have a recurrent bladder infection or something like that. Some patients know to lie, that they know that if they say that they had a bladder infection, that you're not going to treat them. because they probably went somewhere else and they're like, nope, you had an infection. Sorry, I gotta fly. Um, so I think as nurses and physicians and providers, it's really important that we take our consultation seriously, that this is medicine and
Mhm.
they're elective procedures, but they are very important to make sure that we're doing the right thing for our patients and really doing a deep dive into anything that could be a potential
Yeah.
um, red flag or a high risk.
Yeah.
Mhm.
Tracy, I've seen like so many med spas are doing GLPs now that you really should be asking about eating disorders
Yeah,
with GLP patients because that has really been a red flag as well.
yeah, I bet.
Mhm.
Yeah, I mean, we just changed our whole ASIST form. Haley,
Mm,
thank you.
yeah.
A little plug for Haley um, to add in questions
Mhm,
for patients on GPO
mhm,
ones.
mhm, mhm,
Yeah,
That's
it's
great. Thank
important.
you very much for that, really. Absolutely. GLP-1s is the storm that we are in right now. And thank you very much for that answer, Tracy, because asking a question is one thing, but really explaining why you're asking that specific question really will lead you to uncover a whole plethora of answers
Uh-huh.
that we might have completely missed. And it's critical for the procedure and the outcome at the end to be great. So, Rebecca, where do aesthetic practices most commonly lose their competitive advantage operationally, even when their clinical results are strong?
So a lot of, what I'm about to answer here is going to sound very similar to what Naren was talking about. So, and I think also just listening to Tracy speak and listening to Haley speak, we're probably going to have some repetitive answers today. And I hope that everyone listening takes note of some of these things that they're hearing over and over, because with the experience in this room, I think you're going to see what we all find to be really important should be really important to everyone listening as well. So for me, I think where we're losing that competitive advantage is really, again, you could have the best injector if you're an owner, or you could be the best injector or the best laser provider in your market. But if the patient experience depends on who's answering the phone, how they're answering the phone, who's performing the consultation, who's working that day, whether or not the owner or the manager is in the building, you don't have a repeatable business model for that excellent experience every time. And I think one of the biggest problems I see practices is that they do rightfully invest very heavily in clinical education, but they also dramatically underinvest in things like front desk training, consultative
Mhm.
skills, lifetime treatment planning, the follow-up systems to treat, after a patient has been treated, what their goals are for patient retention, team communication, and then just having consistent policies and workflows. We don't always think that the patient experiences those things as a part of their treatment, but I do find that from every, again, Naran talked about the patient journey. It really starts from a moment that they've picked up the phone. It isn't just about the time that they're in the treatment room. So I often tell my clients that are owners, you really have to understand what's happening outside of that really excellent clinical experience they may be getting, because that's really how you retain these patients and how you gain those referrals, right? So a beautiful result isn't going to compensate for, another lead that maybe didn't get followed up with for 2 days, or
Yeah.
the patient has had a confusing consultation. Maybe the clinical outcome would have been great, but the consultation wasn't great, and now they're a little confused. Or, potentially they've been quoted a different price from two different employees, whatever the person said on the phone versus, what is being said during the consultation. And that again is that violation of that patient trust that Naren talked about. So when you want a repeatable experience, a excellent and luxurious patient experience, the message has to be the same from everyone. The providers, of course, are
Mhm.
going to have the clinical knowledge, and I expect all of the providers to be the ones doing the clinical consultation piece. Like Tracy spoke about, and I preach this all the time, is the bottom line of all of this is that this is the practice of medicine. So nobody should be giving medical advice or doing things outside of their scope. But that is, of course, where what that luxury experience looks like on the phone is something as simple as, you know, I see that you're interested in talking about dermal filler. I have two excellent providers, Tracy or Haley. Looks like their one's available on Wednesday at 2, the other is available Thursday at 4. They're going to answer all the questions that you just asked me in that consultation. Which day is better for you? Instead of trying to answer questions, quote pricing, just let the person who should be having those conversations have those conversations. And that should, and people say, well, sometimes they just want to know about price, or sometimes they just want their questions answered. That's really not, that isn't our place as the person who's answering the phone. And I think it's completely reasonable to say that. You know, um,
Mm.
Susan, I know you have a lot of questions. I don't want to speak out of turn because I'm not the clinical provider. That's why we offer a consultation with Tracy or Haley, which day is better for you, right? And I think that that will build some patient trust. And again, if it's a patient who's not willing to pay for a small consultation fee, or if they're really just price shopping, they weren't going to pay to see Tracy or Haley anyway, unlikely, or they might no call, no show, or whatever it might be. So okay, we're not going to win them all, right? But for the people that we want, the patients we're trying to attract, that is going to help elevate that experience again so that it's staying more consistent. It's not something different from one person to the other. So your competitive advantage is never going to be what your best employee does on their best day. It's going to be
Mhm.
whether or not that's repeatable on a Tuesday when the manager is not there, or when maybe a weaker link is working.
Rebecca, wonderful advice there. What I wanted to ask you is now, since you mentioned a lot of the answers might be a bit similar in their nature, because what's really important is really important. I was curious as to know why, in your experience, right, over these 20 years in consulting, why do you think a lot of our aesthetic practice owners, lead injectors, uh, miss out on these matters that are so important? And, yeah, why do they really
That's
miss out on it?
I think what it is, truthfully, is that of course every clinical provider that has been a client of mine, whether they're an owner or they're an employee, they do what they do because they're passionate about aesthetics, and they're excellent providers. They've gone to medical school. They're physician extenders, they're advanced practitioners, but nobody goes to business school usually, right? A lot of times we're kind of learning in the trenches. And so we might think again that this is a bottom line, the practice of medicine. So we're going to be really strong clinically. I just think sometimes the follow-up is, or the lack of follow-up is just straight the fact that maybe we're too busy as clinicians. So it's not at the
Mm,
forefront of our mind. Maybe we're booked solid all day long. So we don't think, or it's I'll call that patient back tomorrow or whatever it might be. Again, when you have consistent workflows and you have consistent policies, then those things won't slip through the cracks. But I think most simply, it's just that, we can be an absolutely excellent clinical provider and just not understand that some of the things in that patient journey are outside of what's happening in the treatment room.
right. Appreciate that, Rebecca. And that's exactly why Business of Aesthetics is here for you. Uh, so we're cutting through the
Exactly.
fluff and bringing you the best and what is practical, right at the cutting edge of technology at Business of Aesthetics here with regards to everything that is practical to you, the practice owner, and any solo practice injector as well. So, with that being said, I just wanted to remind you you're in the right place. Ensure that you're asking your questions away. Please do not leave this webinar with any sort of thinking that is, on the line of, oh, I really wish I asked this question from Rebecca or Haley. So please, just a quick reminder there, you're in the right place. Haley, from your experience building a successful aesthetic practice, what form of differentiation did patients genuinely value? And what did they care about far less than you initially expected? That's interesting.
Yeah, going back to talking about reviews, we have 423 Google reviews and they're 5-star, and it takes a long time to get those. But we hear consistently through that. So this is what patients are. This is how they feel when they leave because they write them after their clinical experiences. Like everyone's so caring and kind, and so it really makes a big difference. Like your staff can be like the best clinical educator, but if they don't make the patient feel like they want them to understand or they feel safe or that they care about their treatment, if they're just transactional, they're not going to retain that patient. And so that's so
Mhm.
important that it's from the front, from the phone call all the way through through the assistant taking their photos, consent forms, the treatment that they feel like everyone has been kind, everyone has been helpful, they've helped answer all their questions, and that they feel safe getting the treatment and that they're not getting overtreated. And I think that is so important that they could care less. I don't think they don't think they care about, honestly, they care about the price. They could care less about the promotion. Because the reason why I say that is in the month of May, we did over $30,000 in microneedling, just microneedling. And there was a promo by one of the companies, which did help, but it was $100 off. But when we went back and tracked that $100, most of them didn't even send it in. They liked the idea of the promo, but they didn't care about going it back and getting the money. So I don't think the money mattered. I think that they were like, okay, well, I'm going to get 3 treatments, and and then I know all 3 treatments are on the books. And then the other thing we do is we create annual calendars for our patients. But I think the big thing is like they feel that they're cared for. They feel that we heard them. And even, back in the day when we were only treating nasolabial folds, and then we went to like, well, you can't do your folds, you can only do your cheeks. Like, I don't agree with that because if a patient they really want their nasolabial folds treated, it's our job to explain and educate why they might want their cheeks done. But at the end of the day, like, there's not going to hurt to put a syringe of filler in nasolabial folds if that's what they want. But that just can't be we can't do that year after year after year. So I think you have to listen to the patient. The practice has to be kind from the beginning to the end. And I think that a beautiful space does help because they feel like it's clean, like, it's safe. But I don't think they really care about the price or the promotion at the end of the day.
That's where we want to get to, right? Where our patients are not as motivated by the price tag. And that seems the relationship seems to be the key here. But you mentioned something really, really beautiful there. Practice has to be kind. Why is that important to you, Haley?
Well, I think it can be scary when you walk in and patients are intimidated. Either everyone looks beautiful or everybody looks young or they don't know what to expect or what questions to ask. So if you are relatable and your staff is kind, they're going to feel more comfortable having treatments done because they feel like I think someone's listening, but I don't think patients stay where they don't feel where it's a kind environment. And we don't have it right now because we're looking for someone right now, but we usually have just a dedicated phone person. And that person is just answering the phone. They're just kind, they're nurturing, they're answering questions. And then we have 2 front desk staff who are just checking in, checking out, and helping with that patient experience. And so when someone, you're usually the first point of contact is either they're texting in, they're having a question they want to get an appointment on, or they're calling. And that person really needs to be nurturing because that's what makes someone feel comfortable and like, oh, this might be a really nice office to go to. So kind is, I mean, we want to be safe and we want to be good, but kind has got to be up there too.
Love that because we usually hear the word nurturing, lead nurturing. But I don't think we necessarily think about that being a form of kindness, right?
Mhm.
Uh, we're doing to a potential patient. So really appreciate the mindset shift that you have made there, Haley. Now, Tracy, how do clinical standards, transparency, and honest patient education help practices build that long-term trust?
I was just going to make a point to Haley's being kind. I think a lot of patients are nervous to come into a clinic, like they're talking about their insecurities. And if you make them feel comfortable and at home and sort of like a nurturing and kind, you'll get a lot more. a better patient experience for them. And my plastic surgeon would say that patients wouldn't talk to him. They come in with me, he goes, how did you get all that information from them? Because they're nervous to see a physician, but a nurse has a different rapport. So when you talk about clinical standards, um, like there's three different pillars that we're looking at when we're looking at the standards and how it can build a long-term practice. Competence, integrity, respect, they're all very integral in sort of that recipe to have a successful long-term trust practice. With the clinical standards, if you have consistent clinical standards across the board, um, it reduces variability. So the patients can feel comfortable with the whole protocol set up and that the assessment steps are going to be the same no matter which patient or which provider that they're going to. And the follow-up care is going to be predictable as well. And for people that have more than one person in their practice, I think it's important that a patient or a client has consistent messaging. So then it's not confusing. It demonstrates professionalism. Again, you've got that structured clinical standards and very professional and not sort of, you know, running around trying to figure out what you're going to do. It's just very structured. It's a disciplined clinical framework. Um, it will signal the expertise. So it's what patients will see when they walk in that door. And like Rebecca was saying, it's not just them sitting in the chair, that's the treatment. It's the whole process from as soon as they walk in that door to who's ever talking to them at the reception desk, look at them and smile. You'd be surprised at how many offices you go in and they're just sitting like this, go have a seat. They're not like really accepting that patient or making them feel welcome. I think transparency is really important because a lot of patients may not remember who did the treatment, but they'll remember more the sort of the knowledge of the treatment, and they're going to feel more trusted the more transparent you are in going through complications and why there's certain complications. Maybe not doing a treatment and why you wouldn't do that treatment. I think with the transparency and even personal experiences that you've had with certain treatments and being transparent of why you may have had something done, patients want to hear that all the time. So what did you have done? I was like, well, let me start the list. I mean, you can't be in the business and not do anything. um, being transparent and sort of building that trust, that clinical trust, it's going to reduce their anxiety. And when you reduce anxiety, you're going to get a more compliant patient with the pre and post instructions. And then you're inviting clinical questions and inviting them to get their questions answered and forming that trusting bond between the two of you. And education is key. Um, I really don't want my patients, or I'm not practicing anymore, but I really didn't like patients coming in and saying that they learned their procedure on Google and now we have AI that's telling patients what to do. Well, AI says that I should have this, this, and this done. So now we have to educate even further beyond what we were educating before because they're being overeducated and not in the correct way. So it's a whole different avenue that we have to take now with their education. And patients just want to, it's better for them to know why you're doing a treatment, not just telling them this is going to be the treatment you're going to have done, but why you've chosen to do that treatment and why you've chosen to use that product and how you're going to inject and really having them being a part of that process. They appreciate that.
No, Tracy, Google AI, sometimes that might be a little bit better to the TikTok situation that's going on, So has it
I'm
become
not I'm
almost
not on TikTok. I don't know.
That's great. That's amazing. You're doing yourself a favor by not getting anywhere near that
Yeah.
situation. But I'm just wondering, right? Has patient education now become almost a part of clinical safety and not just, a part of marketing?
Yeah, I mean, it's always been being that I worked with a plastic surgeon for 24 years that education was key to make sure that patients are compliant. So before
Mhm.
for the surgery, during the surgery, I worked intra-op and then post-op as well. So education is key, but I think you have to listen to the patient's literacy. So if you may have to dummy it down a little bit to make sure that they understand, and then sort of asking questions back to make sure that it's not just yes or no, that they really understand what you're talking about. But when
Mhm.
patients come in and they've got an AI picture saying, this is what AI says I can look like, and you know that that is not possible, then it is having to sort of really sit down and do a little bit more education than what we were used to. And that's where, I don't know if Haley, you had that, or Rebecca, that we used to have the pictures where the physician would take a picture and then they would simulate what they're going to look like afterwards. And then how many lawsuits there was from that, because they would come in with their picture and say, I don't look like this. You told me I would look like this.
Mhm.
I don't think anybody does that anymore, but that was something that was a learning curve for us in not doing that anymore.
Yeah, I can say, I'm still in clinic 3, 4 days a week, and I don't have patients coming in bringing AI photos, generated photos. No, not
No.
yet. Now they might soon, but I haven't, it's usually like hairstyle or something, but I haven't had them bring it in yet for aesthetic procedures yet.
Mm.
Yeah,
Yeah,
we've
usually
had
it's
people with, coming in because AI suggests this is, it
Yeah,
might not be a
yeah,
picture, but AI suggests that I
yeah.
need 2 syringes in my nasolabial fold and I need my temples
hmm
done. And yeah,
hmm hmm Usually AI suggests more than I
so
would, so we could go with that, but
they do suggest a
Right.
lot,
Mhm.
but
It's all
it's a whole
about
different spin on our education now.
Yeah.
mhm.
Yeah.
Yeah, because at the end of the day, AI can only know as much as the user inputs in there. So the user might not necessarily know themselves like what is going on anatomically as compared to someone like Haley or Tracy, who at a glance can tell, okay, you've done a surgery on your forehead there, and that can cause further complications if we go through with this situation. So it's always important to
Mhm.
really know your patient right in front of you and be very upfront with them. Am I on the correct track there, Tracy?
Absolutely. Transparency is key. Yeah.
There we go. Love that. And that's a great differentiator because that's the whole topic of our discussion here tonight. Being transparent will, well, if you make it your differentiator, we have Tracy here to tell you that, she has not suffered as many lawsuits as someone who would be doing those unexpected or unrealistic expectations with their clients.
Mhm.
Now,
Mhm.
Rebecca, before investing in a new laser, here we go, or aesthetic
Yeah.
device, how should a practice determine whether it supports its positioning rather than simply copying competitors?
Mhm. Yes, Don's chuckling at this question because he and I have done a whole hour around this question alone. So I'm going to definitely try to keep it very bullet pointed for you, Don. Obviously it's my favorite topic because I've been on both sides of the device transaction, right? I was an owner operator, and then I've also spent a decade selling lasers. Um, and I often see this in the Business of Aesthetics Facebook page. The top question is, what device should I buy? Right. And usually it's an owner asking their peers. And, you know, I would argue that there's no right answer across the board that anyone should purchase. There's no device that's a good fit for every single practice in the US and Canada, right? It's completely about what the needs of your business is. So I always say, don't ask what device should I buy? The owner's question should be, what clinical or business problem am I trying to solve? And instead, a lot of times it's looked at like, well, everyone around me has one, right? Like Sculpt, everyone around me has one. I probably need one too, or patients keep asking about it. And similarly to what we just spoke about with TikTok, patients aren't asking about a device because they know for a fact that it's clinically going to solve a problem that they've had. They're asking about a device because Kim Kardashian talked about it on TikTok. That does not mean it's the right device for your practice. That does not mean it's the right treatment for that patient. So, but just because patients keep asking about it, that doesn't mean it's the right place, or the right thing for you. There's going to be the rep says, I wrote down here, the rep says nobody else in my zip code has it. The rep will also say it's a new ATM machine. It's going to print money for you. It's going to bring patients into your practice like the bat signal. They're going to say a lot of things. None of that by itself is a business case whatsoever. And certainly the number one thing that is not a business case for purchasing a device is there's a year-end deal. And everyone in this call, if you own an aesthetic practice with a brick and mortar, you will have laser reps hunting you down over the next 90 days because they are all trying to make a year-end number and they all have an end of year deal. None of that is a reason to buy a device. A device is never a differentiation strategy. It's an expensive tool that should support your existing differentiation strategy. So I always say, I often talk negatively about purchasing devices on a lot of these webinars and podcast experiences because of my experience, but I'm not anti-laser. I'm anti-buying a laser for the wrong reason. And so before buying, I want everyone in this room to ask themselves these questions. And I wrote them down because of how important I think they are. Who is your ideal patient? What are the top conditions you're already treating? Big one here. What is the gap in your current treatment plan? And if you are often giving lifetime treatment plans and extensive consultations, you'll know what device you're missing because it's missing in that lifetime treatment plan we're giving our patients. What patients are we currently referring out because of conditions we're unable to treat? Does this technology complement what we're already performing? Does it create better outcomes or have treatment combinations with something I already do? And finally, and I would argue most importantly, does your team actually have the capacity to perform this treatment? And can they sell it confidently? So answering those questions can build a business case for making an investment in this very expensive tool, but a device is not a marketing mechanism. So just purchasing something with the assumption that that's going to bring new patients in is the reason why many practices go under because of being overinvested in capital equipment. It has to serve the existing patient base that you have in a treatment gap that you are currently unable to fulfill. So, I would ask all of those questions. I can go on and on about math
Yeah.
and numbers. Don't ever listen to what the napkin math that the rep gives you because they're going to say, this series of treatments costs $3,000. Your monthly payment's going to be $3,000. Once you sell 2 patients, you've already doubled your income. They never talk to you about things like consumables, provider labor, marketing, service contracts, maintenance, downtime, et cetera, let alone all the financing mumbo jumbo. So, really look very deeply, and especially I would encourage people to have their accountants look at a lot of these things and really dive in as to whether or not it's the right investment. But ultimately, don't copy your competitors. Don't purchase something because someone else has it. It may not be the right fit for your patient base. And then just try to understand whether you're entering something that's maybe a little over commoditized, right? Or oversaturated within the existing market. So my offices that are the most successful when it comes to device sales are the ones who have specific protocols for specific patient selection. They're doing combination therapy. They have excellent clinical expertise. It becomes a part of their whole clinical ecosystem. And again, not just a marketing strategy.
Wow. Thank you so much for that, Rebecca. Really love the list. And wow, what an eye-opener that was. Nowadays, as Haley mentioned earlier on, GLP-1s, right? We're in a post GLP-1 weight, situation here. So with all these GLP-1 cases, right, especially around body skin tightening available to us, it's a different market and everyone want to get something along those lines. What would you recommend to those practitioners?
I've always been a little bit hesitant on body contouring technology. And maybe some providers who, I've been outside of the laser industry for 3 years. I know things change pretty rapidly, but in the 10 years that I was selling different devices and competed against other body contouring technologies, um, even even if there are excellent clinical before and afters, and even if there are wonderful white paper studies, the issue with body contouring often comes in selecting the ideal patient for those treatments. And the margin of patients that are ideal for body contouring treatments is a very, very small margin compared to how many might come in and do the consultation. If you are a good ethical provider, you're probably going to turn more people away with things like body tightening and body contouring because they're just not good candidates. Um, that said, I would argue if we're going to be looking at post GLP-1 body transformation or post GLP-1 treatment plans, I would really stay in the wheelhouse. If you are a practice that relies heavily on injectables and has some technology, then just worry about the face.
Okay.
Many people I know that are post GLP-1 dramatic weight loss are probably surgical tummy tuck candidates at this point. There is probably not much that's going to be able to be done with excess skin, with loose skin that we can achieve, And again, maybe there's some new things out there, but that said, I think there's a lot that can be done on the face with radiofrequency microneedling with some of these minor, minimally invasive surgical procedures that can be done in office, and of course, with all of our different tools in the injectable toolbox. Um, but I would focus on in what your wheelhouse is, and not
Right.
necessarily worry about jumping on that body contouring bandwagon just because everybody's lost a bunch of weight.
Love that. Love that. Rebecca, just before I move on over here, your last point in your checklist said, can our team really adapt this, and can they sell it confidently? You had those two things separately. I'm curious about that, can they sell it confidently piece? Why is that important? And how do we get to a point where they can sell it confidently? What's the criteria?
Yeah. So, and again, I think this is where all of the laser companies fall short. And I
Okay.
say that across the board for either anyone I've been happy to work for and any company that I voluntarily have resigned from. But every single company does fall short in this way. When a device is purchased, many times there can be multiple hand pieces, there could be multiple modalities. Maybe there's different treatments that we're doing within the device. Often the person who's performing the treatment, so maybe you're a non-MD owner, so you have a physician extender who's working for you, or you are the MD owner, but you're going to delegate it away to an esthetician or a laser technician. That training is usually very short. They'll tell you that you're going to get a full day of training. Usually it's a nurse flying in. She's going to fly in and out on the same day. You're going to get a couple of hands-on models after 2 hours, the laser physics didactic. And so when they leave, they're actually not going to feel clinically confident. And I don't know a soul in this business who will confidently sell something they don't believe that they can perform well. We even see this with injectors, right? If it, we maybe have purchased an advanced training for a green injector, and then they leave, and we can't figure out why they aren't talking about the biostimulator, and they're still just they're dabbling with HA. Well, they probably are not confident that they're going to perform this treatment excellently. They're not going to be able to give a good clinical outcome. So then they don't talk about it in the consultation because they're scared they're not going to get the good outcome. So we have to be confident that our provider will be able to clinically be able to do it, because if they don't, they won't sell it. And I'll tell you,
Mm,
I speak from experience. One of the first devices I bought was actually a skin tightening device back in the early aughts. I won't date myself too much. Um, but in the end, the treatment, while I could get decent clinical results from it, just to do around the eye area or just to do a single face area could take me 2.5 to 3 hours as the clinician to perform that full treatment. And I'll tell you, even as the owner operator, I found myself talking myself out of selling people those packages because I would look at my schedule and go, yeah, you know what? That might work on her abdomen, but I'm not sitting in that room with her for 6 hours stamping over and over and over and over again. Right. So I said there was the most expensive coat hanger I ever bought because I just didn't want to do it.
wow.
I didn't want to do it. And that's the reality. So think about that. Make sure that the person that you are entrusting to do the treatment is going to be willing to perform it perform it to its best clinical outcome, and then therefore understand it and sell it, or it's a waste of money.
Appreciate that. And that's very interesting. You started off in skin tightening and now today you are a bit out of the bandwagon as well. But
It's probably why I don't trust any of those devices. I got burned 20 years ago.
Well, the thing is, it's
got
not
it.
so much just finding, like when you're talking about skin tightening devices or like even like biostims, it's not that they wouldn't be a good candidate, but you just don't know if they're going to get a response. And so
Hmm.
that's the thing. Like you could have they don't need surgery, but let's say, because let's just say they're not a GLP patient. Let's just say they just have skin laxity. And you're like, okay, this
Hmm.
should work, but you're like, I don't know. Like, and they're a great
Mhm.
candidate, but it doesn't work and you treat them all the same. So that's the problem with so many devices on the market right now. And that's why you have to be really, really honest with a consultation.
Well, and that's what
Hmm.
I'm saying. I think too, and that both the body contouring treatments and the skin tightening treatments, that I also think some of it, even if you perform an excellent consultation, is also about, like Tracy spoke a little bit about that psychological piece. So I used to say when I had a specific body contouring treatment, you get 10 to 20% improvement with
Mhm.
each session.
Yep.
Well, everybody hears 40% with one session. They don't listen at all to what you're saying. So
Mm-mm.
they expect the result of 6 or 8 body contouring treatments to be the same as a single surgical intervention. And they believe they're going to be the outlier, that they're going to have the best result. And so we're combating against what the patient expectation is to what the device threshold is. Right. And sometimes it doesn't fall on the provider, it is the patient expectation. But that's why I don't know. I don't rely on those things as much as I do tried and true IPL, YAG, resurfacing, CO2, things I can predict and know the
Yeah.
outcome of.
Yeah.
Appreciate that. Thank you very much, Haley. And of course, thank you, Rebecca, for that wonderful explanation. Now, Haley, how do you structure a consultation that respects what the patient wants while still guiding them towards natural, appropriate results, or occasionally recommending no treatment?
Yeah. I think, you have to spend time. So your consultations can't be 15 minutes. You got to spend 30, 45 minutes with a new patient. And really like that's from photography to the whole thing. And sitting down with them, and I always try to like sit like below them. I never try to stand above them. So sitting below them and just saying, hey, like, I had you down the top. I had like one, how'd you hear about me? And two, like, what did you come in for today? And let them start the conversation. And like, do you have something, coming up in your life where you got to get this done in 6 weeks? Or it's just bothering you. We have a year to get things done. So, what you see as a provider, you may see like volume loss in the cheek or temple hollowing, but they could care less. They see this one line right here. So you really have to listen and like have them point to what bothers them. Because today I had a patient and she's like, it's just this right here. I'm like, we got so much other stuff going on, but this was the only thing that bothered her right here. So it was like one little bitty syringe of, filler, and she was super pleased with it. But that's not what I would have gone into, doing for her. But I think that there's so much, like when I got started 20 years ago, we had Restylane and Botox, laser hair removal, and IPL. And now there is, like Rebecca said, there's like, and I mean, and Tracy, we got surgery, we got skin tightening, we got ultra clear, we got erbium, CO2, we got biostims, we got PRP, we had PDRN. I mean, so much that patients can't. You say it was like when Voluma, Volbella, Velour came out, they don't even know what you're saying. They get so confused. So, what I have done in our practice, we don't hand out brochures from the companies. We create our own branded because we want to make sure that they hear what we want them to hear from the procedure, like skin tightening. When I say like we have software with the practice, and what I say is 25% of patients will see a result, and when they see a result, 25% improvement. If you're okay spending that money, then let's do that. But if you have surgery planned in the next, 2 to 3 years, personally, I'd hold on to your money and put it towards surgery. And that's what they want to hear during consultations. Just be honest with them and take your ego out because it's the patient's there to hear what they can do that is realistic. Because remember, I remember this from a plastic surgeon that is now my medical director. He said, I'd rather see the back of their head one time leave than the front of their face coming in over and over again because they're unhappy. And it's so true. So you might as well be honest up front. If you don't think it's going to work, then tell them and let them make that choice. But because there's so much, I tell patients who come in their 40s or 50s, I'm like, it didn't happen overnight. So let's pick the one thing that bothers you right now. And it's usually like if you have a 45-minute appointment and you're going through all the things, you can usually do the consultation and a toxin. That's about what you have time for. And then start prepping them for the next time, like they come back in 3 weeks, and then you can do the filler or the lasers or whatever it takes. But we created these like little calendars on Canva, and they're an annual calendar. Every single patient gets one because even if they get toxin like every, let's say it's August, they're going to get toxin August, they're going to get it December and April. So then we do microneedling like usually 3 weeks later as like relax the muscle, then stimulate the collagen. And then we write that down. And then what we end up doing is, and on the back, we'll write down why we're doing it, what the cost is going to be. We actually scan this into our EMR system, and then we hand it to the patient for them to take home. And then we have a whole calendar for the year of what they're going to do. Now, it may change, right? Like we may have to change a month here or whatever, but patients love to go home with a calendar because then they're like, okay, I can see this, and you're not being transactional. And then it's up to them if they want to, if they have the budget for it. But at least I'm giving them all their informed choices. I learned this like so many years ago from Jill Jones, and Jill was a pioneer in education, and she said there's difference between sinking and sagging skin. And I tell patients like if it's sinking, we need to add the volume. If it's sagging, we've got two choices. We can try to like get a little bit of tightening with lasers and, the skin tightening devices, or we're just going to hold out and we're going to go see a plastic surgeon for the lift. And so oftentimes part of the plan too is like going to see an ocular plastic for an upper lower bleph or for a facelift. So I think that, the consultation cannot be transactional where you just do the toxin. You've got to see them back. Like I like to see their next, I like to have two more appointments on the books, and we book their next appointments before we take payment. So when we walk them out front, we're like, okay, I'm going to see you back in December for your next toxin. Or let's say they're a new patient, we'll see you back in 3 weeks for your follow up, and then in December for your next treatment. So then we got two treatments on the books. Or do we need to do a microneedling in 3 weeks and then their next toxin in 4 months? So I try to get at least two appointments on after they leave.
Okay, I'm really curious about that. Are you not taking any kind of deposit for those appointments?
We do a $100 consultation fee for new patients, but if a patient has been in our practice before and they're saying like they wanted to see Amy for consult on BBL Moxie, we don't charge them for that. But for new patients, we do. And that can go towards a skincare product or their service, but we do charge $100. hmm
Okay.
Yeah.
Now, I'm just curious with regards to that patient you had, who had that one problem just right on their face and one filler fixed it out. You had different, well, internally, you would have done things a bit differently, right? Or you wanted to recommend different things for them from your perspective. Did you make those recommendations after the fact?
Yeah, I mean, she's been with me for years. We talked about we've talked about biostims and fillers and stuff like that. But at the end of the day, she goes, you know what, today, this is the only thing that bothers me. I'm like, okay, then let's fix it, And I very realistic, like we'll put a little filler in there. You're probably still going to see it, but it'll help soften the shadow. I never say correct or, like it's going to make it go away or erase or anything like that. Same thing like with the Daxify toxin that came out. Like I think we learned not to say 6 months on that one anymore. So just being really realistic with the result that you're going to get. I think that's the most honest way to retain patients.
Love that. Thank you very much, Haley. Tracy, why should the patient experience include consultation quality, informed consent, safety protocols, and of course, follow-up care, and not just the treatment itself?
Well, I mean, as we mentioned earlier, it's not the treatment process or the clinical pathway isn't just the treatment itself. There's a whole clinical pathway that goes with it. And when you look at any of the medical legal reports, or I'm always looking at the discipline decisions that nurses have in medical aesthetics across Canada. And most of them, it's not the treatment itself, it's kind of how they were treated, what was done or what wasn't done, as opposed to just the treatment itself. Um, I think the consultation is kind of your clinical safeguard in that this is where, which we mentioned, this is where you talk about their medical history and really getting an in-depth um, history as to any medications that they're on that could cause a contraindication for the procedure that you're discussing. Um, you're looking at the psychological benefits or the psychological issues that could be involved with that. And a lot of people do have, will bring into the practice the BDD checklist that they have. It is prevalent, as everybody that's on this call knows, it is very prevalent in aesthetics. And that's why it's a high incidence of legal issues that surround our specialty. um, looking at any risk factors, any red flags that would be there, that's where that consultation is extremely important. And as Haley said, I always left 45 minutes to do a consultation, anywhere from 45 to an hour. And rarely would I do a injectable treatment unless I already knew the patient. I was just going through their medical history at the start, doing the good faith exam at the start, and then we would do an HA filler. But most of the time, I really wanted to get to know the patient, as a not as a face, but as a person. So holistically getting to know the patient. Um, as I got older in I always was very good at remembering names and faces and things like that. And as I got older, I would have their picture so that I could remember and write notes. They have a daughter named so and so, and they went on a trip here and there, so then they think that you actually remember them. So it's building up that personal connection when you're doing that consultation. The informed consent is extremely important. Again, medical legally, it's extremely important. Um, Even with, I mean, you're talking about what, you know, um, all the risks and complications that can happen, even the remote ones. So now we have to talk about stroke, and any cerebral vascular incidents that can happen when we're doing HA fillers now. I would always get the patient to sign the consent form as to the cost of the procedure that was being done, because there was a few times where I would say 600 and they would go out to the secretary and she would think that I said $60. And then there was always a thing. So I always made them sign the consent form and initial for the cost as part of their informed consent. But it is a legal requirement that you have to have. And then you have um, uh, the medical legal cases. So the clinical safety part of it includes, again, your intake screening or your medical history, your emergency. You have to be extremely prepared for any emergency that can happen. We always suggest to do like mock codes, like a VO code, so everybody in your clinic and your staff knows what would happen if you had a vascular occlusion and where the products are kept. Keeping them all in an emergency kit so that when it comes out, everything's ready. Infection prevention. My secretary, which was quite funny, which was my sister, made the public health that they had a new program that was for medical aesthetic clinics. So I sent her to the public health, and they suggested to clean with bleach. So I came into the office the next day, and it was like, oh my Lord, she washed with straight bleach. She washed the floors and everything, and her eyes were burning. And she goes, "This is what they," and I said, "Well, you probably were supposed to dilute it, maybe." But anyway, everything was very clean. But yeah, making sure that you have following infection prevention practices. And then the follow-up care is really important for patients in that you're going to bring them back in. And with the follow-ups, it's either you're going to recognize that there is a pending adverse event and you're going to catch it early, you can identify it and you can start the management process to it. You can make sure that they're being compliant with their follow-up orders. And if they're not, then you're going to change the process a little bit. Um, and it's the reassurance and that continuous care. I would find that for the first time that I saw a patient, I would always bring them in that 2-week follow-up, just so that I could make sure that I was happy with what was being done. And then after they've come in a few times and repeated treatments, I would ask them, do you want to come in 2 weeks? Because we can book an appointment and you can have that appointment. Or do you want me to give you a call? And most of them would say, if I have a problem, you'll hear from me. So I left it that way. And I'm sure in the US too, we have to have a communication consent signed through Health Canada to allow us to, it's called an anti-spam law. So communication consent so that we can text, we can message, we can email them. So they had to sign that as well. So it's a full clinical, it's not just patient on a treatment bed. There's a whole clinical pathway that has to be followed from right from the start to finish. It's like the nursing process.
That. Tracy, just real quickly, what if we don't follow that process? Just give us the consequence of
So
the
if somebody just
situation.
came in and they didn't do a thorough proper consent, and say somebody was on or they had a bladder infection, which is what happened with one of my patients, one of my BDD patients, which was she wanted her treatment done. She had a bladder infection. If I treated her with an HA filler, that could have caused some devastating results down the line. Um, so it's sort of, if they're on blood thinning medications, anything like that, if they're immunocompromised and you're doing a treatment on somebody that's immunocompromised, that is not under control with medications or it's dormant, that could lead to severe consequences as well.
Right. Thank you very much for that explanation, Tracy, because the reason why I asked is sometimes we need that extra push to ensure that we are, staying compliant on all the good practices that are available to us, just to ensure
Yeah.
safety, not just on the patient side, but also for us as well, in terms of
Yeah.
just not being
Yep.
liable for causing such an unfortunate outcome. Did you want to add anything there, Tracy?
Some people will do some people, when you're doing your informed consent, so we would do it at every treatment.
Mhm.
And you're just initialing a date. You're not actually initialing a consent. So we went through the medical history every time, talked about their medications, thorough medical history. Then they signed a brand new consent every time. And I think medical legally, that's the better option.
Medically, that is definitely the
Mhm.
better option. Practically, also, it should be the
Yeah.
better option.
Takes more time, but it's worth the time.
Right there. Rebecca, let's talk a little bit about business metrics. So tell us, what are some of the business metrics that tell practice owners that the differentiation strategy is generating sustainable profitability and not just attention, inquiries, or social media engagement?
Yeah, in general, Don, I find when I do discovery calls with my clients or when we're actually sitting down and starting to discuss some of these key performance indicators or their metrics, the average business owner um, has metrics that they're looking at that I like to call vanity metrics. And some things vanity metrics wise may matter, but in the end, that isn't really a true indication of your business performance. So I want to make sure that I kind of differentiate the difference between these vanity metrics and what are true business metrics and what you should be looking at. Followers do not equal revenue. And I know we talked a little bit about social media in the beginning. So I do want everyone here who doesn't have a lot of followers, isn't getting a lot of likes, but is still busy, that just because the injector or the celebrity injector down the street gets a lot of likes, gets a lot of engagement. That doesn't mean you're doing something wrong, does not equal revenue. I also argue that the people that have a lot of time to spend doing 2 or 3 videos on social media a day are probably not super busy with their schedule. So, just reflect on that as you will. But I just want to make everyone, I want people to understand likes are not retention, followers are not revenue, and leads are not patients. So, getting a lot of leads doesn't really mean anything, and paying for leads it isn't always recommended because, like I said, that isn't going to necessarily turn around and make you profitable. So I think that there is having some attention on your marketing will show me that it's working, but your conversion, your retention, and your margins are going to tell me whether or not your business is working. So some things will say, yes, marketing's working. That's not always going to tell you for sure that your business is working. And I think a lot of my provider owners and my non-provider owners don't always have a really good idea of what those numbers actually look like. So something that we have to look at is lead to booking conversion, right? Like Naren talked about. Are our inquiries that are coming in actually getting us appointments? The consultation to treatment conversion of the people that are coming in, whether we paid to get them through the door or they were referred, are they then booking to have that treatment done after the consultation? Look at your average patient spend. Like Haley mentioned, right? Transactional aesthetics is not where it's at. And I can tell you, and unfortunately, in a lot of injectable heavy practices or where we only have injectables in our toolbox, we may just be happy to have that tax patient come in, do their tax, and have them leave because maybe we don't have a lot of other resources out there to treat other things. But at the very minimum, we should be getting them to do more areas of tax. Have you ever thought about doing your lower face? Or we should talk to them about, are you ready to do that lip? We've done a couple lip flips. You're happy with that result. Are you thinking you want to add some volume to the lip now? Right. Now, of course, if we have lots of other things in our toolbox and we're able to do these comprehensive consults, these lifetime treatment plans, Haley, I'm obsessed with your annual calendar. I'm going to start rolling that out. It's a perfect visual of the things that somebody should be doing annually to enhance the results, keep the results. That increases your average patient spend. I mean, just think about what Haley said too. They're coming in for tax 3 times a year, and maybe that, the average tax patient is $600 to $800 per treatment. That's $2,400 a year. But now if we're adding on skin pen, or better yet, RF microneedling, that's another $1,500 to $2,500 that we're adding to that particular patient. So that changes the margins, from a lower margin treatment like injectables to a higher margin treatment like maybe a device, right? Your rebooking rate. How often are they booking their next appointment before they leave? I think Haley's strategy is a key. That's something people should be doing immediately in their practice starting tomorrow, is have a conversation with every single one of their providers about having the conversation about getting them rebooked today before they're checked out, and make sure that the front desk understands that things like, well, I'll call you to let you know when I'm ready, to have something to handle that objection, something that says, you know what? 3 months from now is going to be the holiday season. Tracy gets extremely booked. Let's get you on the schedule right now. And if anything changes, give me a call. We'll be happy to move it around. But we really should get it on the schedule before you leave, making sure everyone understands that, because if they have an appointment on the calendar, they're less likely to reschedule than they are to call you when they're ready. Right. And of course, the retention. I hope in a lot of EMRs that are out there have the ability to run this report. And if you haven't run it before, how often are your patients coming back or still with you 6 months post first appointment, 12 months post, 24 months later? When you get to the point where your patient's been with you for at least 24 months, you probably have a 5-year patient, right? That loyalty that has been built around your trust, your patient experience, and your lifetime treatment planning means that just because the new place down the street's now offering Botox for $8 a unit, they're not willing to bet that result against Haley's result or Tracy's result. They want to stay in that practice, right? So, I think that's really important. And then I think everyone needs to know the profitability by each service, the profitability by each device. And I'm not talking about gross revenue, right? Because there's financing, there's consumables, there's labors, or there's your overhead. So I always say your revenue tells you what you're selling. Your margin tells you whether or not you should still be selling it. So you know, that's something, knowing all of those numbers are really important. And then I want to be certain that people also understand that if they do have staff members working for them, what the profitability of a staff member is as well. I did have a situation recently where I took a long, hard look at a past 6 months of all of the injectors in a specific practice, based on the amount of hours they worked, based on the amount of revenue they brought in, and based on what we pay them. And unfortunately, there was one injector who we were spending more on payroll than they were bringing in. And at that point, you know, I joke, but it's a charity case, right? This is not good for your business. If what you have put out in payroll, if they're not even meeting, you are paying to keep them employed. And I think a lot of people don't necessarily know exactly how good those numbers are, because maybe we're meeting our daily revenue goal, or we're meeting our, you know, it looks like, oh, we did $30,000 this week, or we did $120,000 this month. Well, that means nothing if your margins are minimal. It's going to be difficult to scale and keep your doors open. So I think that really, really having an understanding of those numbers is the most important thing.
Rebecca, just a little follow-up on that last point there, regarding the profitability of a staff member. What's like the multiple you would suggest? Like, what's the benchmark multiple that we should be looking
Mhm.
at?
So I've always said that if somebody is 3x their labor cost, not 2x, 3x, they're just about breaking even. Because especially with injectable heavy practices, their revenue, because the cost of the injectables is so high, and the amount of revenue that they're doing means it's not just 2x, right? We have to account for the cost of goods. So, you know, the bare minimum that anyone should ever be doing is about 3x. My goal for green injectors to get to in their first year of employment, or for newer employees, even if they have experience somewhere else, would try to build their books up to get to 5x. I wouldn't, and of course, every state and I'm sure Canada is different too. In terms of how we compensate our medical providers, I have very strong opinions about paying commission and productivity bonuses in the medical space. And people don't always agree with me. I think we should just pay our providers really great hourly living wage and leave it at that, because it's the practice of medicine. But again, if you are going to bonus someone, you know, some sort of productivity bonus or something along those lines, it needs to be they have to be at that 5x threshold or higher. And then if they are producing at least 8x revenue to, you know, what their payroll cost is, it could be a good time to have a conversation with them, you know, potentially about whether they're working, you know, opening up their books a little bit more, getting more hours, or potentially giving them an increase in compensation, so that you keep them happy. And I think really great injectors who stick around can sometimes be difficult to find. So I want to make sure that people are still well compensated as well.
Love that. 8x is possible, everyone.
Mhm.
I've never seen it.
Not even from your best. So I
8x.
think,
So you're saying, so I just want to make sure I want to be on the same page. So what you're saying is
Mhm.
that they're producing 8 times what they take home.
So whatever their gross hourly is. So let's say it's a nurse that makes $40 an hour, to average $320 in revenue an hour. I think that's feasible.
Yeah. So I work with Maven Financial Group, and they're a group that,
Uh-huh.
yeah. And so what we
And it's
typically
Andrew,
say is
right?
like, yeah, we typically say anywhere from 18 to 25% is what a provider should be taking home. Any more than that, like your margins are just way too small.
Mhm.
So
And I would agree, especially in, again, an injectable heavy type of
yeah,
practice where or where you have devices that have really high consumables, then yes, your margins are going to continue to get smaller and smaller.
yeah.
And that's not scalable. I think a lot of times too, I'm so sorry, Haley. I think some of
No,
it too, and you're obviously working with Andrew at Maven, so what your practice is at versus, you know, maybe someone who's a little bit smaller. I think it also ultimately depends on goal of, are we looking to scale? are we looking at a 5 to 10 year strategy for private equity? There are certainly different ways and margins. I work with a lot of, I like to call mom and pop shops, where their threshold for what they look at in terms of profitability might be a little bit different. But yeah, I purely mean if we're paying someone $40 an hour, the very minimum they should be gross revenue bringing in would be at least 320. So
Yeah.
if we're paying someone 50, would be, and I think that's just a good way to know how many hours somebody is working as well versus the amount of money we're paying them, things like that.
Yeah. Yeah. I mean, that's a thing. I mean, that's another whole conversation with private equity.
Uh-huh.
But I mean, private equity is not paying anybody $40 an hour. I mean,
Yeah.
they're paying them salaries of $140,000,
Yep.
$160,000 with pet insurance. So it's
Right.
really tough for us to, be
Mhm.
competitive as an employer with a lot of the private equity. That's like one of the hardest things I've noticed lately.
And I think that that's the increase in private equity and the increase in chains really is hurting a lot of my
Yeah.
clients specifically. It's
Yeah.
difficult. Again, I think that's the thing
Mhm.
that we are hitting on completely in this conversation too, is just the differentiation. I would rather be Nordstrom and be surrounded by a bunch of Walmarts. They can fight for that demographic, and I'm going to fight for mine. But it just kind of depends on what each individual practice wants and who their ideal
Yeah.
patient is.
Yeah. I think it goes back to what Tracy also said too, is that there's so many, well, there's one major platform in the US that is taking smaller, like one-off injectors, and they're giving them this business in a box.
Yep.
And it's like they're but I was on a call today earlier with them, like, well, we really didn't get the teaching and the education we needed. So they think they're
Mhm.
getting this like business in a box, or policies or protocols, everything they need. But I would just like really caution them that and they're getting their medical director with it too. Well, do you know your medical
Yeah.
director? Will they have
Mhm.
your back
Right.
if something happens? And then do you really have the policy? What happens? We had last 2 weeks ago, we had a anaphylactic reaction to a GLP. So rare. We had to call 911. So like you've got to know like how to handle these major complications when they happen. So yeah, I mean, it goes from like the pay scale all the way to like policies and procedures, right? It's a
Yes.
lot.
Well,
Mhm.
we're looking at the corporate practice of medicine, and that's what we've been trying to prevent.
Hmm. Yeah.
Yeah. Yeah. And I was just going to put in where you talked about the commission structure. In Canada, it's part of the
Mhm.
nursing regulatory body. We're not allowed to make a commission. That's a conflict of interest in that you're going to do more syringes than what the patient needs so that you can make more profit. So we can't do a
Correct.
commission structure.
Yeah.
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 Many
And I
do,
agree with
but we're
that.
not
I get a lot of
supposed
push.
to.
Yeah. I get a lot
Yeah.
of pushback, but like I said, I think it's just the practice of medicine is more important than anything.
Yeah.
Well, I'm going to
Yeah.
push back a
Yeah.
little bit. I think you can do commission and still practice medicine. Like
But you can do what we say is a bonus. Give them like you can
yes. Yeah.
do a commission,
Right.
but don't call it a commission. Call it a monthly bonus.
Yeah.
Yeah. Yeah.
Yeah.
Mhm.
But I think there
But we,
are some,
Yeah, definitely.
yeah, I do think though that if that extra pay doesn't mean that someone, now I'm not saying that's 100% of the case because I can totally understand where this reasoning, like where you're coming from. But I
yeah.
also think that there are a lot of safe, good providers out there that do earn a commission that aren't going to just think about the bottom line either.
Right.
Yeah.
No, no. And we'll work after hours and work weekends and things like
Yeah.
that to
Hmm.
see more
Yeah.
Mhm.
patients and have more drive. Yeah.
Hmm.
Um, I
Exactly.
was
Yeah.
I, I was going to ask Rebecca, the patient or the nurse that wasn't holding her ground, um, what did they do? Like, how would you deal with that?
Yeah, so I knew it was looking over at the schedule from a higher foot view. I knew that that particular provider wasn't bringing any new patients in, and they were working full time. And I just don't think we should be hiring anyone full time that doesn't have a book of business. But ultimately, the conversation we had was, a um, 60-day performance improvement plan. And again, we didn't jump to this person doesn't need to be at 8x in 60 days or you're fired. It's nothing like that. But there was also a few things that I felt like may have helped increase, if your book is empty, I want to see you go out with 14 business cards, have a set number of 14 businesses you're going to try to partner with, make the effort to get out there and network yourself. Gave her a
Mhm.
referral link and said, if you can get 5 people to book with this referral link in the next 60 days, if you can, instead of doing this transactional aesthetics, if the next person who comes in for a full consultation, if you can, I'm going to sit in, I want to hear you do that lifetime treatment plan. And ultimately, I will say she came back to me and said, I just don't know that aesthetic medicine is for me.
Okay.
Because ultimately,
Mhm.
right, this was her third practice that she was at in 18 months as an aesthetic injector. Which again, right, 3 practices in 18 months is a little bit of a red flag to begin with, but ultimately, and I
Mhm.
say that there's a line in the sand when it comes to regular nursing and being a nurse injector, in that it takes the same amount of clinical intelligence, but being a nurse injector takes a hell of a lot more grind because the
Yeah.
patients don't just come to you, right? So you have to be able to go out, build yourself a brand, and so it just, ultimately her decision. I didn't have to let her go because ultimately her decision was, I'm
Good
not
decision.
sure I can do anything you listed here. I just think this
Mhm.
might not be for me. And it's
Mhm.
okay. Well, no harm,
Mhm.
no foul. But I think
Yeah.
we had
Good.
to have the tough conversation for sure.
Mhm. Mhm. And I think it's tough for nurses that have been working in the hospital and all of a sudden they have to sell, but
Yeah.
they can't
Yep.
be known as selling. And it's a
Mhm.
fine line on learning how to do that and being ethical about it.
Mhm.
Might not be
Right.
her thing.
Mhm.
Exactly.
Mhm.
Okay.
That is the beauty of business of aesthetics, everyone. I mean, wow, I really loved it. I was just really, this is what I live for. This is what I live for. Great discussions. So now we are about to arrive at the end of our event here, but we have a
Oh,
little interesting segment. The Ask Me Anything session. Here we go. We can share this slide on our screen here. Um, so please go ahead and ask your questions in the chat or the Q&A box below. You can either raise your hand as well, and I will just unmute you and you can ask your question live. So until our attendees get a bit warmed up, I did select a couple of questions from our community here that align with some of the topics that we were talking about. Where is that question? Okay. Okay, this is an interesting one. If one person is handling reception, sales, follow-up, and social media, at what point does saving payroll start costing the practice in patient experience and growth? I sort of paraphrased it a little bit, but yeah, that's the question. The everything at front desk manager. Uh, hmm. Rebecca, would you like to
Mhm.
give your thoughts on this first, and perhaps Haley?
Yeah, I think, again, I just talked about how much revenue an employee brings in, but I do think that there's another side, right? That we have to evaluate whether or not it's time to bring in an additional, I always say heartbeat, bring in an additional heartbeat to help assist, again, if we're talking about wanting patient retention and increased of luxury patient experience. We often, as business owners, try to find these unicorns. And we're trying to find this person who's, oh, she went to aesthetic school, but she doesn't have patience. So I'm going to hire her to answer the phone. And she's young. So we'll have her do TikToks. And, when we try to find someone who is a jack of all trades, they become a master of none. And, maybe that person should just be mentored into being an esthetician who has some front desk, knowledge and is able to help out. But we really shouldn't try to have people do everything. That's also, every office manager I've ever spoken to, that's probably the role that gets the most burnt out because we're playing clinical assistant, we're playing admin assistant, we're answering phones when someone calls off, we're having to, if we're not doing the social media on our own because everybody thinks that we can just assign that as a side job to everybody, then we're managing the social media company because the owner and the provider can't do that. So I would argue, you really should have a lot of specificity in a role. um, what that role is and when you want to hire is a very individual conversation that I have with people. But I do think trying to find and create this unicorn is where we sometimes run into issues.
Mhm. Haley, would you have anything to add on to that by any chance? Since
Yeah, I do business coaching on the side too, and a lot of nurse practitioner, nurse owners, they are getting ready to hire their first or second and second staff, and they're like, I don't know who to hire. I'm like, well, create a list of things that you don't want to do anymore. So create a list of
Exactly.
like, if inventory, if answering the phones or scheduling or taking the money, like what is it that you don't want to do or you can't do anymore? And that becomes a job description. And then you're just going to try
Mhm.
to find someone who aligns with that. And so it might be a clinical assistant. It might be someone that's front desk, patient concierge. It could be an office manager. So it just those roles
Mhm.
evolve as your practice gets bigger. But I would tell you, like when I first started, I actually just had someone who did the scheduling, helped me develop the EMR, answered phones, things like that. And then I got an assistant second. That was my second employee. So that was kind of like my trajectory for that.
Appreciate that. I was also just curious if it's okay. I mean, like, it's difficult to evaluate requirement, but if one of these new heartbeats, one of your staff members are able to generate up to, 3 to 5x per se, is that enough? Or else, like, how can we say that this is enough for you to do specificity of the job role? Rebecca?
Again, it isn't just that number. It also has to do with, you know, um, their productivity. So, the percent amount that they are booked. It, I think it's also individual based on the practice. It's hard to give a really blanketed answer. Um, but you know, it, when I do, and I should say this, when I speak to specificity, I do think that everyone in your practice should have an understanding, obviously not on the clinical side, but an understanding of what goes on in the day-to-day practice. And everyone should have the ability to answer the phone. Everyone should have the ability to check patients out. There shouldn't be providers that say, oh, I don't, I don't ever want to check anyone out, or, oh, I don't have to clean the bathrooms. I mean, everybody should have some participation and should be on the boat rowing with you, and doing all of these things as a team. I just think that where I see some employee burnout is when we're expecting too much, of a lot of different roles. So, again, we can cross train people and we can certainly have people do, and share responsibilities and some other things, but no, I don't know that there's a specific number or a specific metric. I think, again, like Haley's idea of what needs to come off of my plate for me to be a better X. So whether that's a better owner, a better nurse injector, a better, what is it? Where am I the bottleneck too, right? That should be something else that we're evaluating. Where am I the bottleneck to the growth of this business? So if I'm spending more time on admin than I am on seeing my patients, then it's time to hire an admin because you're driving the revenue. So it's a number of different factors. I think a lot of times it's just asking yourself the really tough questions.
Okay. Um, Haley, do you have anything to add on to that by any chance?
Well, like when you're thinking about hiring your next injector, like is it when they're 80% capacity, they had only 20% capacity, and that didn't really work for us because Courtney her patients didn't book out. And so she was busy. She was generating a 1.1 million, 1.2 million. So it was an 80% capacity because I would look at her schedule and there wouldn't be much on there, but I knew she would produce it. So then we ended up hiring another injector, but it had nothing to do with being like 80% booked because I looked at her schedule. She really wasn't. But the second injector we have um, worked has worked great. So sometimes people just break the rules sometimes. So, it just depends on how much you want to scale as well. Like, do you want to be a smaller practice or do you want to have a larger practice? You have to, like Rebecca said, you have to ask yourself, from where am I answering these questions that are hard? What do you want?
Right. And to break the rules, you got to know the rules first, right? That's the key. Now, Tracy, there's a question in our Q&A box. This is right up your alley. Great discussion. Thank you very much. Why are the majority of nurses in Canada still earning commission?
Well, not the majority of nurses. We just did a poll of the nurses across the province or across Canada, to see how people get paid. And there is still some nurses. It used to be very prevalent that nurses would get paid a hourly rate, and then they would get commission on top of what they did. So taking out the cost of product and then doing like a 70-30 split, that type of thing. And that's where the nursing college came down and the physician college came down and said that you can't do commission. I am sure that, yeah, some people still do it. I think most people are bonus structure. If you do well, and it may be a bonus structure for the whole clinic, or it may be just for that provider itself. But most, I would say majority, according to our poll, they get paid either a weekly salary or a monthly salary, and that goes with authorized prescribers as well, because we were talking about how much authorized prescribers get paid. And some will get paid commission and some will get paid just a monthly or weekly or per consult amount. So I
Okay,
wouldn't say
there we
that
go.
all the nurses in Canada are getting paid commission, but
Right, we got
it's
that.
still out there.
Right. Appreciate that, Tracy. Now we have arrived at the top of the summit here. Uh,
That went
I would love
quick.
to get a key takeaway. Oh, I'm glad that you felt that way, Tracy.
Yeah.
Uh, yeah, a key takeaway, please, if you don't mind, of our discussion, that our practice owners can put into place tomorrow to be the differentiator in their market. What's the most important aspect of it? Perhaps, Rebecca, you can start us off on this. 30 seconds or less.
Yeah, I mean, I think the ultimate measure of differentiation isn't whether or not people notice you. It's just whether or not the right patients are choosing you, staying with you, and referring other people to you. And I think that that is what allows you to maintain really healthy margins while delivering that exceptional care and that luxury patient experience. So I think differentiation needs to be looked at more as a business strategy and less as a marketing strategy.
Love that. Haley?
I think one thing we didn't talk about, but you don't have to differentiate yourself by doing some of the high risk areas. And so you can build a really solid, good practice by doing glabellas all day, glabella toxins all day long, lips and cheeks, and not doing foreheads and noses. So don't feel like you have to do that to be different in your area.
Okay.
Mhm.
Appreciate that reminder, Haley. Tracy, wrap us out.
Yeah, I would say, looking at the whole treatment experience or the clinical experience, right from as soon as they walk in the door, and making sure that you're following all your practice standards and guidelines through your state colleges, and really doing a thorough um, consult to really rule out the adverse events that could happen, or looking at those red flags. And as Haley said, be kind. Kindness
Mhm.
just goes such a long way.
Mhm.
Just really make them feel like they're part of your family, really.
Mhm.
Appreciate that. Uh, right. So that being said, I do want to remind our practice owners in attendance as well as watching this, uh, to make the best use of the marketing strategy meeting with Equa here. If your ideal client, if your ideal patient is searching for the services you offer, make sure you're the practice that is found, trusted, and then, of course, chosen. The link will be dropped in the chat one last time. QR code is on the screen there for you to book. All right, then. I would like to give this moment now to our wonderful panelists. Rebecca, where can the people find you and the work that you do?
Yep. You can find me on Instagram at Apex Aesthetic Consulting and also at apexaestheticconsulting.com.
Apex, it is. Tracy.
I am on Instagram as well as thmaconsulting.com. Well, THMA Consulting. Same on LinkedIn, same on Facebook. I have a Patreon as well, that there's no charge for Patreon, and it's mainly blogs and information like lidocaine toxicity and things like that that are on my Patreon.
Interesting. Thank you very much, Tracy. Haley, where can the people find you?
Instagram as well, Haleywood_NP. And then our practice website is thelookaesthetics.com. And then my coaching is theaestheticcoach.com. So Instagram is the easiest. Yeah.
Easiest to get in touch with, absolutely. So, uh, Rebecca, Tracy, Haley, Naren, um, thank you so much for this wonderful 2 hours of sharing your expertise with our audience. And thank you very much to our audience members for really investing these hours into the success of your practice. As you exit this webinar, a quick feedback survey will pop up. Please do take 30 seconds to just let us know how we did, what can we do better so that the next event will be even more valuable to you. With that being said, it has been my pleasure hosting this event on behalf of the Business of Aesthetics community. Dan Adisha signing off. Until next time, take care, everyone. Bye bye.
Thank you.
Bye.
Bye-bye.